Great. As I say, welcome to the first meeting of the Alberta Health Services Board. I'd like to just start by getting right into the agenda, and we can sing it perhaps, or dance, I don't know, a little music in the background. All right, I think those of you in the audience may have copies of the agenda. I'd just like to ask if there's any comments on the agenda, any changes or additions? No? Secondly, I'd like to ask if there's any declaration of conflict of interest by members of the board. No? Okay. So good afternoon again. My name is Linda Hughes. I'm the chair of the new Alberta Health Services Board, and I'm pleased to welcome you to the meeting. I'd like to just introduce my fellow board members, if I can. David Carpenter from Lethbridge, Marlis Taylor from Edmonton, Hugh Somerville from Drumheller, Vicki Kaminsky, you know, our CEO, Brenda Himmelgard from Calgary, Richard Discerny from Edmonton, and Glenda Yates from Ottawa. Those are your members of your board. It's with great regret and sadness that we are having our first public board meeting so shortly after the news that Vicki Kaminsky has resigned from her position. On behalf of the board, I want to again state publicly how much we appreciate her contributions to AHS, how sad we are that she's going, and what a great job she's done for healthcare in Alberta. The organization was really fortunate to have someone of her caliber leading healthcare delivery in Alberta over the last many, many months. I'm looking forward to working with Vicki in the coming weeks as she's going to help us ensure that there's a smooth transition, and the board is going to start immediately looking for a recruitment process for a new president and CEO. Well, this is not how the board had hoped to begin its work. All the board members are very reassured that there's a strong executive team in place at AHS, and they will provide the leadership we need to continue the delivery of health services in Alberta. AHS is blessed not just with excellent leaders, but with talented and very hard-working people throughout the organization who deliver the highest quality of health services throughout Alberta every day. Last week, the new board members participated in an orientation session where we were given an overview of the health system and some of the tremendous work that's being done within the organization. And we were reminded that AHS is just 7 years old. The amalgamation of the regional health authorities into a single system was one of the largest corporate consolidations in Canadian history. It was an enormous and complex task, and there remain challenges. As board members, we acknowledge those challenges and the turbulence of the last few years, and we commit to Albertans that we will do our very best to support the leadership of AHS and the employees and the physicians who work in the system as they meet those challenges. The number one goal of everyone on this new board, the reason I think all of us signed up, is to endeavor to bring stability and good governance to Alberta's healthcare system. Vicki's departure will make that a little bit tougher in the short term, but as board members, we remain committed to bringing strong and stable governance. That begins today. This won't be a very exciting meeting, and it will be short, but we're starting with the building blocks we need as a board, and that means striking a governance committee that includes all members of the board. This new committee will work at defining our mandate and our responsibilities in governing AHS, defining our structure, and also our committee structure. In the interim, the board is, as well as striking a governance committee, is mandating the continuing work of the 4 existing committees, which are audit, finance, human resources, quality, and safety. Our goal is to develop an effective governing structure that will give the healthcare system and the people who work in that system the stability they need to continue delivering the highest quality healthcare in Alberta. And now I'd like to hand over to Vicki to say a few words.
Well, thank you very much, Linda. And first of all, thank you and all the board members for being here today and for agreeing to take on what is probably one of the biggest but really most exciting challenges that I can imagine for a board in this country. It's been my experience that having a governance board is one of the key success factors for any organization, and so you're very, very welcome relief, and I'm very pleased to see you here. And I sort of feel like now my work is done.
No.
So, having said that, I have to tell you that in the last 20 months or so, I've had the extreme and wonderful pleasure of working with one of the best executive teams, and in fact, 110,000 people that are committed to providing care, excellence in care, and continuity of care for everybody in Alberta. And I think we're very, very fortunate to have them all here, and certainly they will provide the continuity and the stability that's required. So having said that, it was with really mixed feelings that I presented the new board with my resignation as president and CEO. I have honored the contract and given 3 months' notice, and we can discuss what that looks like, but really, it's really and honestly personal reasons that are putting me in the position of tendering my resignation. There's no hidden bad things happening. It's all good, and really, truly an exciting time for AHS. So I think the board setting out on looking for a new CEO is a good opportunity. There'll be a solid governance team, a solid executive team, and a new president and CEO that's going to take AHS into the future and really let it become and help it become the organization it can and should be. So I would wish the board success. I wish all of the employees, physicians, and staff the best in the future, and I thank all of those who have emailed me to say we're sorry to see you go. A lot of people saying you're the best CEO we've ever had, and I can tell you that's only until the next one comes along. So it gets better and better for AHS and for everyone here. And to the media who may be here or listening, I'd like to say thank you very much. You've been very kind and responsible, I think, since I got here in reporting some of the events for AHS. And that's going to be a key as this board gets on its feet and gets things going, and with a new CEO, keeping that perspective about what's necessary to be reported and the way that it's reported, building trust for the people of Alberta and, in fact, for the employees of Alberta Health Services as they continue to do what they've always done, provide care. So thank you, Linda.
Oh, thank you very much, Vicki. All right, moving to the next item. Turn that on. Moving to the next item on our agenda, which is the continuation of our current advisory committees to the board. This is for the transition period as we develop our own board structure. Would someone like to make that motion?
I shall, Madam Chair. So you want me to read this thing out?
I do.
Okay. I move for our board to consider the resolution to approve the continuation of the advisory committees of the AHS official administrator, namely the Audit and Risk Committee, the Finance Committee, the Quality and Safety Advisory Committee, and the Human Resources Advisory Committee as board committees. Secondly, to approve the terms of reference of the committees in the form approved by the official administrator. And thirdly, direct the acting corporate secretary to make such non-substantive changes to the terms of reference to reflect that the committees are, as of November 27th, 2015, committees of the board.
Great, thank you. Can I have a seconder? Glenda, thank you. Any comment about this?
Yeah, I'm just going to kind of explain it. AHS is a large organization, the largest health organization in Canada, and certainly the largest organization of any kind in Alberta. Providing governance and oversight to an organization of this size requires a tremendous amount of time and a tremendous amount of focus on various areas. It would be difficult or probably impossible for the board to meet at such frequent intervals as to deal with all of these particular areas. When I was official administrator, I relied heavily on committee structures where we could focus in on audit, or we could focus in on human resources or quality and safety to make sure we understood those particular things and to move forward. This resolution is intended to be for a transitional period of time while the governance committee, which we'll talk about in a minute, takes a step back and sees which committees are going to be most appropriate for this particular governance structure that we're now entering into. But in the interim, in this transitional period, I think it would be wise for us to continue with these committees and so that they can review the material and make recommendations to the board.
All right, for our next item is the establishment of our new governance committee. Will somebody move that motion?
If I may, Madam Chair, I believe I could speak to that matter. And I will make a motion. I move that the board consider the resolution to approve the establishment of the governance committee as a committee of the board.
Seconder?
I'll second.
And if I might briefly speak to this motion, there are a few different reasons why we should set up a governance committee. First of all, legally, we have a statutory obligation under the Alberta Public Agencies Government Act to prepare a mandate and roles document. So it's important that we get a governance committee going fairly quickly to prepare that document as required by the legislation. From a practical standpoint, AHS has been operating without a board structure for quite some period of time. It's essential that we really take a close look at our roles and responsibilities. Good governance requires that we not only take a look at that, but really prepare some detailed outlines of what the roles and responsibilities of the Board of Administration are. Once that is done, we can look perhaps at other committees that would be useful as part of our structure, such as community engagement or other such things. But for now, it is really essential that we set up a governance committee to organize our roles.
Anyone else? All those in favor of the motion? Finally, the third motion, which is the approval of the committee membership during this transition period. Would somebody like to make that motion?
I'll jump into that one again, Madam Chair. I move that the board consider the resolution to appoint all board members to all 5 advisory committees of the board, to reappoint the following individuals as external members to the noted advisory committees of the board. Audit and Risk, Don Sieben, Chair, External Member, Doug Tupper, External Member. Finance Committee, Don Sieben, Chair, External Member, Doug Tupper, External Member. Quality and Safety, Doug Tupper, Chair, External Member, Don Sieben, External Member, Barb Burton, External Member, Dr. Tom Feasby, External Member, Gord Winkle, External Member. Human Resources Committee, Barb Burton, Chair, External Member, Don Sieben, External Member, Doug Tupper, External Member, Martin Harvey, External Member.
Someone second that motion?
I'll second the motion.
Thank you. Any more discussion about this?
If I can jump in just briefly again, I've worked with these committees and with these folks. When you're official administrator, you act as or in place of the board, but it also leaves limited time for or opportunity for debate, unless you disagree with yourself a whole bunch, in which point you're on the one hand and the other hand. But nonetheless, I relied extensively on the advisory committees and on the people who populated those advisory committees to understand the issues and to advise me as things proceeded. So these people have done yeoman service and have really done a good job, and I think it's going to be important to establish a sense of continuity as we move from the administrator structure into a board structure, to have, at least for a short period of time, the views and the expertise of these people as they have contributed in the past. So I'm going to use this opportunity, although I have sent each one of them a letter of thanks. I'm going to use this opportunity to publicly thank them as well for their tremendous contributions to AHS and to Alberta. So for some of that knowledge to get passed along, clearly we have to be there too. And we have not had the time, we've only been together for a very short time at this point in time. We have not had the time to assess the strengths and weaknesses and desires and of each of the board members. So this will be a way that each of the board members can sit through some of the committee meetings and get an idea what they do and get an idea what their interests are and where they feel they can contribute the most. Clearly, it is a transitional resolution at best, and once governance committee again has an idea to consider the committee structures and consider the appropriate membership, populations of the committee structures. They will be coming through with different recommendations as we proceed. So this is short-term, it's transitional, but it gets us, keeps the organization stable and keeps us moving forward.
Thank you, David. Any other comments? No? Quiet group at the start? All right, all of those in favor of the motion, please say aye. Oh, that's carried. And that is the end of our exciting agenda today. So our future meeting, our next meeting will be January 28th, next meeting of the board. And with that, I would take a motion to adjourn. Glenda, second? Nobody wants to quit. All those in favor? Thank you very much. We are adjourned.